Thank you very much for the invitation to speak here about this somewhat obscure subject. Could also introduce it by now for something completely different. This is work that is based on a fascination I've had with the vitreous since I was in medical school, and the first work that I saw was by Jan Wurst. In 1971, he described the premacular bursa as an empty structure overlying the posterior macula. Here you see this in a cadaver eye seen from the back, right next to the area of Martigiani. And he reconstructed in his mind this complex system of cisterns within the vitreous, where the premacular bursa connects to this retrociliary system of cisterns, and was, in his mind, separate from Cloquet's canal, or what we maybe should more appropriately call the prepapillary gap. This was later somewhat modified by Shoji Kishi in 1990, who examined the same space but gave it a different name, the posterior precortical vitreous pocket. He made the important distinction from Wurst's view of things, that there is actually a cortical layer separating the bursa from the eye wall, and also that it is a confined space until later in life, when it may, in the context of vitreous degeneration, connect to other liquid structures within the vitreous. Now, aside from the premacular bursa next to the area of Martigiani, Cloquet's canal, Wurst also described these cisterns. And Georg Eisner in 1971 described these prevascular vitreous fissures, or Lücken as he called them, that were present over the larger vessels over the posterior pole. These did not feature in any of the preparations of Jan Wurst or Shoji Kishi's, and so there was a question, how do these structures all relate to each other? Well, why do we care about this stuff at all? Well, I think as vitreous surgeons, we see them all the time. This is a picture that Rick Spade published. We stain with triamcinolone, and there you see the bursa. This is the area of Martigiani probably, and then there are all these cisterns. And at the end of the talk, I'll also show a slide where I think this is of really clinical relevance. Now, is the bursa a confined space, or does it connect to any other spaces? So this study was done with the Triton. We published it in Ophthalmology a couple of years ago. I think it was the Atlantis at the time, actually. And what we saw is that just below the nerve, you see the bursa in isolation. As we get closer to the optic nerve, we see again the bursa, then the area of Martigiani, and then the beginning of the prepapillary gap that contains Cloquet's canal. But there's a nice septum, which Jan Wurst called the septum interpapillomacellary. This becomes more tenuous, and eventually you see how these spaces fuse, and then follow a common course that kind of goes outside of the area of detection of even the most advanced machines with the widest scan widths. And so we had to modify Kishi's model, where you have the bursa as a separate boat-shaped space within the vitreous, separate from Cloquet's canal. With this model, where it turns out that the premacular bursa joins at a variable distance from the optic nerve, the Cloquet's canal, and then forms this kind of mitten-shaped structure that then follows a common course through the center of the vitreous. Now, what about the gaps or fissures? Can those be seen in vivo? And again, this is a study with the Atlantis, and what we found on cross-sectional OCT is that we could actually visualize these gaps. So you can see these prevascular vitreous gaps or fissures in young eyes with relatively intact vitreous overlying the blood vessels as these hyporeflective lines going into the vitreous. In tendentially older eyes and also eyes with higher axial length, here you see the bursa, you can see these larger spaces, which we think correspond to the cisterns, again overlying the blood vessels. Later in the context of vitreous degeneration, they seem to connect to other larger spaces, in this case the premacular bursa. Now, open questions that remained, remember this was done with 5-line crosses, so we only could sample a limited area over the posterior pole, couldn't really see this in continuity. Are these prevascular gaps really continuous, as Eisner had hypothesized? And then how do they relate to these cisterns? And how do they relate to the premacular bursa and the prepapillary gap? So this is where more recent web source technology helped. We did a pilot study of 21 healthy eyes. Range was 11 to 35, so young patients with attached vitreous. The axial length revealed that these eyes were in the emmetropic and myopic range. This particular study was done with the Zeiss Plex Elite, and we examined 9 by 9 millimeter and 12 by 12 millimeter OCT scans. And what we set out to do is, rather than what we're used to, namely, moving our slab deeper and deeper into the choroid, we moved it in the opposite direction. So we created a 60 micron slab, normalized it to the vitreoretinal interface, as you can see here, and then we moved that slab anteriorly and captured the resultant movie. And we also, as we have to do with these vitreous scans, adjusted the brightness to enhance the vitreous image. And this is the first movie I will show you. This is an 11-year-old emmetropic male. What you first see is the emergence of these prevascular fissures as these hyporeflective gaps. And then this is the premacular bursa, separated from the macula proper by some cortical vitreous, and then septum here with the area of Martigiani. But then very late in the scan, further up into the vitreous, they seem to connect to each other. And then you also, already in this 11-year-old, you see how the vitreous is separating into, denser, more intact areas, and then other kind of liquid-filled spaces. So kind of here in slow motion, just to recap, these are the prevascular vitreous fissures. Here you see a separation of the area of Martigiani from the premacular bursa by the septum. And then you can see how here, marked by the asterisks, these fissures have widened into cisterns. And while there's still a septum present fairly close to the retina, here there seems to be a connection between those spaces. Now, this movie shows the other end of the spectrum. This is a 34-year-old myopic female with a high axial length, and you can first see the fissures, but very quickly they widen and become these really fairly large cisterns that eventually here you see some aggregated fibrils that are a hallmark of vitreous degeneration, and then later you see how these spaces just connect to the other. And this is kind of what you also see at the slit lamp if you kind of go deeper into the vitreous, where you see more formed parts and then all these lacunae. So that's the spectrum of vitreous degeneration that we found in our study. So the prevascular fissures are a universal feature in these young eyes with relatively formed vitreous. So see this in contrast to the cisterns that become significantly more prevalent with increasing age and degeneration in these eyes that have a lot more vitreous degeneration. Now, we not only acquired these Z-scan movies, but we also looked at vertical cross-sections. And Rick Spade has pioneered this with his dynamic focusing and windowed averaging, and shown us that we can penetrate the vitreous several millimeters now, in contrast to the spectral domain devices. This was also possible with this device, and what was very interesting to me was that in the young eyes, we could actually see bursae or posterior precortical pockets that indeed looked confined. This is something that I did not believe existed, and is kind of what Kishi had always maintained, that this is a boat-shaped contained space. And this really seems to be the case, at least in the young eyes. And so we have kind of termed this, the dollop or the Hershey kiss kind of bursa. It's pointing usually anteriorly, in contrast to in older eyes where you're familiar with the extension of the bursa pointing superiorly. It is a confined space that doesn't make any connection to the prepapillary gap, and the prevascular fissures are very slender, and you don't really see any true degenerative spaces. Whereas in this eye here, you can see the premacular bursa, and then here a fissure plane. Rick Spade has termed this a supramacular bursa. These are usually slender channels that are more eyewall parallel rather than pointing into the vitreous, what you see here. And they don't seem to have an end, and they make very many connections to surrounding spaces. Now, what is very striking, you may be familiar with these pictures, is the resemblance of here you see these stills from the Z-scan. with Georg Eisner's preparations of vitreous, where he used cadaver eyes, suspended them in a cuvette, and then provided slit lamp illumination, slit beam illumination, and then took these really wonderful pictures. And now finally we're at a point where we can reproduce similar images in vivo at arguably much higher resolution and without any artifacts. But you know, you may or may not agree with me that these are very cool images. They show us something very fundamental about the anatomy that we previously couldn't really study in vivo. But how is this at all relevant? And I think where it's maybe most relevant from a surgical perspective, there may be other physiological roles of the bursa, but where it becomes pathologically important is in proliferative diabetic retinopathy. And we published this in Retina with tons of OCT images if you're interested, but just schematically, where it's important is in terms of which spaces the blood vessels proliferate in. And I think when these blood vessels actually grow into those fissures and cisterns in young eyes, what they effectively do is they anchor down the cortical vitreous, and those are really those very tough cases where you are not able to just do a nice cutter segmentation and are done with it, but where you have to get out, you know, your chandelier and work on this bimanually with scissor and forceps. So in summary, en face, SWEPSOURCE OCT allows visualization of a network of prevascular fissures. It demonstrates the development into and the continuity with the cisterns as the vitreous degenerates, and deep vitreous penetration suggests that the bursa starts out as a confined space without any connections in the young. And again, I thank you very much for your attention, and the organizers and Topcon for a fantastic meeting.